Before we start, we wanted to share with you what you've told us about your readiness for the Strengthened Standards. And thanks to everyone who's responded in our pre-conference poll. So our first Menti question was, I understand how the standards are changing. And we can see most of you are on the journey to understanding the changes and would like to know more. And there's a healthy 20% who are all over the detail. So that's great to see. Our question 2 was, my organisation is getting ready for the changes. And so we see a similar picture of readiness. The majority of you are on your way, but with more to do. And again, a really good sized group who feel confident about where they're going to land. And our third question was, I am using the Commission draft resource pack to get ready for the Strengthened Standards. And we're delighted to see a very large, sizable majority of you are using that resource pack. So it's really exciting to see such a high level of engagement as we go into the discussion today. So what makes great care? The standards are the promise we make as a community to older people about what they can expect from their aged care experience. They are right at the core of trust and confidence in aged care. Older people tell us that great care is personal, respectful and kind, that great care is built on an understanding of the older person, who they are, their culture, their identity, ability, diversity, their beliefs and their care experiences. So great care means clear communication and a partnership with the older person where they have choice and support to make decisions. Great care is adaptive and receptive to the needs and preferences of older people as they change over time. And great care enables older people to live the life they choose with dignity and respect. Essential to delivering great aged care is great leadership and strong corporate, financial and clinical governance. Great care is transparent with a strong culture of open disclosure where mistakes are acknowledged and learned from. Great care needs a great aged care workers with the right skills and behaviours supported through a positive workplace culture that values learning opportunities to build continuous improvement. Great care is connected, including all the people and services that contribute to the care of an older person. So these are the themes you will find in the Strengthened Standards. There is nothing here that should be unfamiliar to you, but what you will find that is different is much more explicit and detailed articulation of what we expect to see in delivering safe and high quality care into the future. So I want to take some time to talk about some of the key features in the Strengthened Standards that are applicable to home care and where we think it would be useful for you to focus in terms of thinking about your own readiness. And those of you who joined us at last year's conference may remember that we presented our analysis of the key changes to the first iteration of the Strengthened Standards, which was released in March 2023. So we've updated that framework analysis to highlight the key changes in the most recent version of the Strengthened Standards published in December 2023, alongside the exposure draft of the New Aged Care Act, and you can find that on our website. So this document and slide on our screen, moving from right to left, shows that 13% of the requirements of the Strengthened Standards are now new expectations, 63% were clarifying current expectations, and 24% are aligning to current requirements and legislation. So if you are a details person, you'll enjoy our 140 odd pages where we list every outcome and action to identify what the changes are. But for those who want something a bit more high level, we've just published a short summary for each standard where we call out some of the key things and themes, and I'll go through those now. In Standard 1, you will find an increased focus on person-centred care, which is also reinforced across the 6 standards. This is about how you and your staff plan, deliver and evaluate the care and services you provide to older people. And most importantly, it is care that is respectful of and responsive to the preferences and needs and values of the older person. We're looking for a partnership between you and the older person, their family and carers. Diversity and dementia care are 2 of the 5 focus areas called out by the Royal Commission to be better reflected in the Strengthened Standard, and you will find clearer requirements to implement strategies to identify the older person's background, culture, diversity and beliefs, to deliver care that is culturally safe, trauma-aware and healing-informed. Transparency is also a key theme, including supporting older people to understand their agreements. Standard 2, the organisation. Governance is another focus area called out by the Royal Commission. The Strengthened Standards have a strong focus on your strategic settings and systems. Providers need to be able to show how they're managing specific requirements in the standards systemically across your organisation. So when we talk about systems, we mean a way of working, organising or doing something that follows a plan or a set of principles, rules and processes. The systems we are looking at direct and control how you deliver quality care, for example, your end-to-end risk identification and quality management systems or your incident management systems. We want to see systems that support great care because we want to be assured that your practice is repeatable, embedded throughout the organisation and not only reliant on the good work of individuals. And as you all know, monitoring, reviewing and continuously improving systems and processes is pivotal to delivering safe and high quality care and of course the improvement of all care over time. So you can expect us to be interested in how you undertake monitoring, reviewing and improvement. We want to see how your systems and processes lead to positive outcomes for older people. For example, partnering with older people. This must be more than talking with an older person about their care plan. It includes what you are doing throughout the organisation to support partnership with people you care for. How do you know if you're doing it well? How do you know if it increases positive outcomes? And what are you doing to continuously improve? This includes when things go wrong, where we expect you to practice open disclosure and communicate with older people, their families and carers and also your workforce. As the Commissioner outlined in her keynote today, we want providers to clearly show how they remedy or understand and fix the problem, partner with older people and restore trust and prevent reoccurrence. For example, we want to see where you've resolved complaints by using open disclosure processes. We've talked a lot about open disclosure and its role in the management of incidents and complaints over the last few years. This concept is well embedded in Standard 2, alongside organisational governance to ensure it is an embedded part of your culture and systems. So this will be an important part of getting ready for the new Aged Care Act and a rights-based approach to delivering aged care. So Standard 3 tells us how providers must deliver care and services to the older people they care for. This includes ensuring effective assessment, planning, coordination and communication of their care. Each of these elements should be tailored to each older person's needs, goals and preferences. And all of this is realised through your strong, capable and supported workforce. In Standard 3, there are a couple of new actions, one that relates to caring for people with dementia, to encourage them to use their skills and strengths, and the second being aligning care and services to older people's needs. So when delivering care and services to older people, providers need to understand the care needs of each older person and recognise what is most important to them. Standard 3 strengthens the requirements around handover of care between workers and others, and also draws attention to regular review of arrangements where there are transitions. So Standard 4, the environment. So in Standard 4 you will see much of what is in the current Standard 5 relating to the physical environment and equipment. It now also provides a clear distinction on the requirements for supporting safe and quality care and services in an older person's home. It has a stronger focus on environmental risk assessments and actively promotes engagement with older people on their living environment. Environmental risk assessments will require providers to assess and regularly monitor the environment of an older person's home. For example, where older people have impaired mobility, these assessments should be seeking to identify hazards to safe movement within the home. Providers are required to engage older people on how the risks can be reduced. Standard 4 also includes outcomes related to equipment and aids provided by the provider, which is consistent with the current Standard 4. It also incorporates effective infection prevention and control measures as a core part of service delivery to protect older people, their families, carers and workers. Standard 5, clinical care. Clinical care is another of the 5 areas identified by the Royal Commission for greater focus in the strengthened standards and now has a dedicated standard. We all know good clinical care enhances an older person's quality of life and reablement. And while we know this standard will not be applicable for all home care providers, we wanted to touch on this important change today, especially for those who deliver nursing services. The standard now has dedicated outcomes for clinical governance, the safe and quality use of medicines, caring for people with cognitive impairment and clinical safety. For example, in outcome 5.5, there are specific actions relating to choking and swallowing, continence, falls and mobility, nutrition and hydration, mental health, oral health, pain, pressure injury and wounds, and sensory impairment. Providers will be expected to regularly review and improve the effectiveness of their systems and processes for clinical safety. And although clinical governance in this standard only applies to providers that deliver clinical care, Standard 2 maintains the importance of governance in the delivery of quality and safe care, including the appropriate oversight and monitoring of the health, wellbeing and safety of older people receiving care. Standards 6 and 7. These standards are relevant to providers that deliver residential care only. So you will notice Standard 6 relates to food, nutrition and the dining experience. And this new standard recognises the importance of the food and dining experience to the care experience and quality of life and wellbeing for older people. Standard 7 is about all aspects of the community of a residential care home, and this includes the older person's sense of safety, belonging and inclusion, along with the availability of meaningful activities for older people to engage in, as well as managing transitions in care. So this has been an area of focus for us at the Commission for some time. We have a food, nutrition and dining advisory support unit and hotline to help providers deliver higher quality and more nutritious meals to older people in aged care, and you can find a full range of resources on our website, and we've just opened for expressions of interest in our menu and mealtime review program. So I hope that gives you a sense of where we are heading with the strengthened standards and what is relevant to you as a home care provider. For a detailed picture of what we expect, please take a look at our draft guidance documents, which we know most of you have. We have published a separate document for each standard that explains your obligations and practical steps that you can take to meet the outcomes of the standards. And it's important to note that how you apply the guidance will depend on the circumstances of your service and the needs of the people you care for. So where we think there are different expectations specific to residential or home care, we've included content specific to the service type. So this is a key area where we have been looking for feedback, and you will see that we've also included content that is specific to the role of governing bodies, providers and workers. We've also published separate guidance documents for workers, and this is intended to bring each of the standards to life in a simple way with some practical examples of actions and behaviours that are important to how workers deliver their care. So a big thank you to all the providers, or all of you, that helped us to prepare our draft resources, and everyone that has participated in our roundtables over the last few months and our online feedback. We will be updating the guidance based on the feedback from our public consultation process, which is running to the end of this month, closes it next week. and we'll say a bit more about the other documents you can see on the screen as we go through. So registration categories. I want to now take us to how we will audit performance against the strength and standards under the new regulatory framework. The purpose of audit in the new regulatory framework is to inform registration and registration renewal decisions and promote continuous improvement. Importantly, audit won't be the only factor that drives registration decisions. As you have heard this morning, we will also be drawing on all the data and information we hold that helps us to understand a provider's performance. So if we find risk through an audit process, we will consider this information as part of our risk-based surveillance and monitoring program, which is our primary tool for identifying and responding to the risk to older people. So it's worth having a quick recap on what we've shared in the registration plenary sessions and how audit requirements vary across the different registration categories as part of a renewal of registration process. A reminder that the standards that apply are not the same for everyone, but depend on your registration category, and you can see which standards apply to different categories on the right-hand column on the slide. The basic rule is that if the standards don't apply, there is no audit. And if you deliver a combination of services, an audit will include only those service types where the standards apply. Audits are at the provider level. In categories 4 and 5, we collect the provider level information once and use a sampling approach to evaluate care and services to older people at the service level. And for residential care, we collect the provider level information once and will audit every residential care home. So all audit outcomes will inform the registration and registration renewal decisions. So I want to start by sharing the outcomes of our 2023 pilot audit program. In total, 40 pilot audits were undertaken across 32 providers who represented the diverse types of services, locations, size, specialisations and older people receiving aged care. The purpose of the pilot program was to test the draft standards and our new audit methodology. We evaluated the outcomes of the pilot program, including all the feedback we gathered from participants in the program, and we'll be publishing a report on this next week. So I want to share some of the key learnings with you now. So while the pilot program did not reach as many home care providers as we would have liked, we were still able to gather some key learnings specific to home care, and we're continuing to refine and test the audit methodology, including with home care providers. So we found that a hybrid audit approach combining on-site and off-site activity are the most effective audit model, with off-site activities supported through the request for information step at the beginning. The hybrid model increased the efficiency of evidence gathering, particularly where providers operate from one or more care and service delivery sites. We tried gathering evidence at the action level, but found this approach resulted in duplication and inefficiencies, so we now gather and assess evidence at the outcome level. Audit findings will be made for each outcome and for each standard. We trialled a new streamlined format for audit reports and captured the detailed evidence to support audit findings in an online digital audit tool. We found this supported effective decision making, and providers were very positive about the increased transparency provided by the tool. We also found that the pilot audits required more time and effort for both auditors and providers compared to the current quality review process. So this was largely due to the need for additional time to understand and apply the strength and standards and train auditors in the new methodology. And we did find, as this improved towards the end of the project, where there was a reduction in time and effort required to complete the pilot audits. We also found the increased detail in the strength and standards impacted the efficiency of pilot audits as well as auditability, and there were multiple instances where outcomes and actions across the strength and standards were duplicated. So these issues have now been addressed with the department in the current version of the strength and standards, and we've also provided clarity for both auditors and providers through the draft guidance. The intent when designing the new audit methodology was to develop a framework that supported consistent, accurate and efficient audit outcomes, and we found that around 80% of both providers and auditors said that the audit process supported an accurate assessment of the quality, care and services, including identifying any risks to older people. So importantly, audits provided consistent and accurate audit outcomes for the same provider, even when audited by different teams. Feedback from our own Commission auditors indicated that smaller and newer providers were challenging to audit due to their resourcing constraints and lack of understanding on how to implement the strengthened standards. And we hope our guidance material will help in resolving these issues. We are also looking at how we better support smaller providers to get ready for the strengthened standards. So specific to home care, we found our sampling approach for engaging with older people in category 4-5 didn't work well. And we have improved this by ensuring that the sampling of older people is considered and explored in discussion with the provider now at the start of the audit. We also need to ensure timeframes in the audit process allow providers to inform older people about the audit to ensure meaningful engagement with the auditors and collection of evidence. And we'll be making refinements in the request for information and meeting agendas for the various audit meetings. And we are considering combining the request for information and the pre-audit preparation tool into one to reduce duplication and assist you to understand what policy and processes are relevant to conform with each standard. So we've taken on board the learnings from the pilot and are continuing a program of trial audits. And our findings from this process include that providers are very positive about having provider information collected once at the beginning of their audit program. Providers would like more information to support them to prepare their response to the request for information and engage effectively at the provider, board and senior management meetings. Providers told us there's room to further streamline our evidence mapping framework to reduce duplication and repetitiveness in interview questions and document requests. And we also know we had a bit of work to do to tailor our questions to home care providers. And we are delivering our preliminary findings on conformance ratings at the closing meeting, and providers have welcomed the clarity and transparency, as well as the opportunity to start addressing deficits identified and preparing a response. The clinical oversight focus lends itself more to residential care, as a clinical care in home services can be episodic. So we know there is more to do to apply the standards to how clinical care is delivered in home services. And another key finding was that we need to consider the context and challenges of delivering care more actively for remote and NATSIFAC services with greater focus on outcomes, noting the practices might be different to mainstream services. We also found that we need to provide better training for our audit teams about how they should approach audits of NATSIFAC providers to ensure that our assessments are fair and consider culture. And that work is underway. So I want to be clear that we don't ever want to assume that people should get a lower standard of care because they live in a certain place or belong to a particular culture. But what we do need to recognise is that safe, high-quality aged care will look different for some services and older people, and our focus needs to be on understanding what great care looks like in each circumstance. So I want to turn now to the new features of the audit methodology. Firstly, and most importantly, our focus for audit now is to form an overall view of the provider rather than just considering performance at the service level. So this is essential under the future state regulatory framework because registration will happen at the provider level. Our current audit programs for both residential and home care services have a service level focus. The current legislative framework requires site-level audit for the purposes of reaccreditation for residential services. There is some flexibility currently for the home care service setting, where the legislative framework supports a multi-service audit or quality review of home services. This will change under the new Act, where the framework focuses on a provider's performance in relation to their care and service delivery across all funded programs. So most of our sector is made up of providers who deliver multiple services and care types. And in residential aged care, multi-service providers account for about 80% of services. And we know the home care sector is very diverse, with around 1,600 providers delivering a broad range of service types across home care packages and CHSP. So if we can drive continuous improvement at the provider level, we will be maximising capability uplift across the sector. Our new audit methodology focuses on understanding the provider as well as getting a view of home care, how care is being delivered at a service level. This new approach will reduce some of the duplication that providers with multiple services currently experience. To help providers get ready and transition to the regulatory arrangements, we are already including all of providers' home services into a single multi-service audit approach. So this ensures providers start to become familiar with the new audit arrangement and also create efficiency for providers by reducing duplication and evidence collection and review. So let's go to the audit, to the process of audit. The Commission will contact a provider to initiate the renewal of registration process. We will advise the provider that the registration renewal process has commenced, including when you must submit a renewal application, and this will also commence the audit process where an audit is required for your registration renewal. The audit process will begin with a request from the Commission for providers to complete the pre-audit preparation tool and the request for information. The intent of these tools is to allow the Commission to access as much information as possible for off-site review. And getting this information up front in the audit process also means that our audit teams have a good understanding of the provider before we get on site and to help focus our on-site activities. So both documents are currently out for public consultation and further testing with providers, so we anticipate some further changes in response to feedback before they are finalised. We will then have an opening meeting with the provider and key service personnel where we will take you through the audit process and check our understanding of the information already provided and arrange scheduling of interviews. We will meet with the provider's governing body and senior management team. And this is part of our evidence gathering process around provider governance and gives governing bodies the opportunity to talk about things that they want us to understand. This might include telling us about what is going well and examples of innovative practice, as well as raising issues around challenges and risks and how they are being managed. The next step is our on-site visit, and this is mandatory for all residential services and Category 4 services where respite care is delivered in a respite environment such as a respite centre. And I'll talk a bit more about our evidence gathering processes shortly. So we also hold a closing meeting with you and discuss our initial findings, where auditors identify any risk or issues or likely non-conformance with the standards. We will discuss it with you to understand whether you're aware of the issue, whether you know what happened and the root cause or source of the issue, and what actions have been taken to address the issue and its root cause and the expected timeframes for completion. We will then prepare a preliminary audit report to record the preliminary audit findings and audit gradings for each outcome and standard and share that with you. This report is supported by the detailed evidence record in the digital audit tool, which providers will also be able to access. So we're also introducing graded assessment. We are moving from our current binary pass-fail or met, not met model to graded assessment across 4 grades. Graded assessments provide greater clarity, transparency on provider performance and promote continuous improvement, and our auditors will provide a grade both at the outcome level within each standard and at the standard level. The 4 grades will be conformance, where we are satisfied with performance against the standards. Minor non-conformance, where there are opportunities for improvements or gaps are identified in the provider's systems and processes that are not systemic and not high risk for older people. Major non-conformance. This is likely where we find high risk to older people. And a reminder that we expect providers to have systems in place to support the delivery of care. You would need to show us how these systems are implemented and how you monitor and improve those systems. Where you can't demonstrate your systems to provide quality care, this is likely to lead to a finding of major non-conformance. Exceeding. So we are still working on the framework for this. Our current thinking is that this would apply where a provider has achieved conformance against all the standards and can meet some additional criteria. So we will ask you to review the preliminary report and provide a response back, including any additional information that you should consider, that we should consider. We will ask you to correct any factual inaccuracies, and then we will issue the final report, which was also given to the Commissioner's delegate who is making the registration renewal decision. Going forward, we will publish an updated version of our methodology, currently available on our website, to take account of any changes that we're making. We'll also be publishing what we expect to be the timeframes of the various steps in the audit process. But a key message that I want to leave with you is that the intent of many of the changes to our audit methodology is to give you, as the provider, greater agency in what you put in front of us and to help us to understand your organisation and to demonstrate your conformance. And of course, we will identify things we want to see, but we encourage you to think broadly about what you put in front of us that helps us to understand your organisation and how you deliver care. So that takes us to the exciting topic of our evidence framework. We know that transparency for the Commission is important, and we have published our draft evidence mapping framework as part of the resource pack that we currently have out for public consultation. The primary purpose of the evidence mapping framework is to support auditors in the evidence gathering process by providing a standardised set of targeted questions and examples of evidence aligned with each of the evidence categories. Providers can use the framework, though, to help you identify how you demonstrate conformance and prepare for audit. The evidence mapping framework is not intended to be an exhaustive list of questions and documents, but it is designed as a guide to support auditors to identify the most relevant and high-value evidence. We recognise that the relevance of the evidence examples in the framework will vary depending on your circumstances, including the needs of the people you care for. So we encourage you to provide the audit team with other forms of evidence where you have it. The evidence mapping framework is structured around the key concepts or topics in the strength and quality standard that we have grouped into 21 key themes or areas of practice. This approach recognises that many of the concepts are relevant across multiple outcomes and helps to minimise duplication. So under each theme, we show each of the relevant outcomes, evidence categories and examples of the sorts of evidence we will be looking for. So we gather evidence across a range of categories and sources to support greater certainty, accuracy and reliability of our audit findings. Where that evidence relates to feedback, we will include example questions. Auditors are encouraged to adjust and adapt the wording or ordering of their questions as they need to. And you will see that we have identified where we look for different evidence at the provider and service level, as well as where evidence might be different across different registration categories, for example, between residential and home care. Provider level evidence is gathered and considered at all associated service locations, environments and residential care homes. The focus of the provider level evidence gathering is to understand the systems and processes in place, including those for monitoring your own performance. Service level evidence gathering will be more focused on the testing, the implementation of those systems and processes, and this includes understanding the experience of older people and their care outcomes. And where we find that a residential care home or service environment implements systems and processes which are different to the providers, we will need to assess the service level systems and processes being used against the standards. And we also want to understand why the provider systems and processes are not being used. So there are three overarching questions we are testing through audit. Firstly, do the design of the provider's systems and processes deliver on the intent of the outcomes? Secondly, can we see those systems and processes implemented in practice? We will look at this through the lens of the older person and through the worker lens. Thirdly, how is the provider monitoring how those systems and processes are applied in practice, assessing how well they work and making improvements to deliver care? And across all the different evidence categories, the older person's experience of care and services and care outcomes are very important to us. The older person's experience and feedback is critical to understand whether the systems and processes you have in place are actually achieving safe and high quality care. So to close, I want to tell you a bit about what is planned next to support the sector and yourselves to get ready for the strength and standards. So I've already mentioned the provider resource pack that we published for public consultation on the 6th of February, and that consultation period closes on the 30th of April, and we'll publish a summary of the feedback detailing the adjustments that we'll be making to the resources based on that feedback. We're very conscious that the current format of long, wordy documents won't suit everyone, and we're delighted to be showcasing an early version of our new digital standards education tool at this conference. So a big thank you to the providers who've helped us to design and test that tool. You can have a chat to Commission staff at our table in the display area where you can check the tool out and tell us more about what you think. We'll be using this base content to develop learning modules, posters, videos, infographics and other things that you can share with your staff and the people that you care for. There will also be presentations and toolkits that your learning and development staff can use to train your people on the ground. And we're conscious of the importance of tailoring our readiness program to support diversity in our sector. So we are developing dedicated engagement and education readiness programs for both First Nations and called older people providers and workers. We are co-designing a range of different resources in a variety of formats and languages. And thank you again to those providers and stakeholder groups that are participating in that process at the moment, and we very much look forward to showcasing the results. And we will continue to release products to inform and support the sector as we land them. We started with the strength and standards because this is where the policy settings were landed first, but you can expect us to take this same approach, both transparent and collaborative, in helping you get ready as detail of other reform elements is landed. So if you want to get further information on the co-design and testing of our resources, you can drop us a line at agecarequality.gov.au or use the QR code on the screen. So that's the end of the presentation piece. I'd now like to, we'll bring the panel to the stage, so I'll introduce you to our panel. We have, we have Ingrid Leonard. I'll wait till you come to the stage and then I'll... So we can put faces to the names. Ingrid Leonard, Assistant Secretary, Choice and Transparency Branch within the Department of Health and Aged Care. Michelle Kotis joins us, General Manager, Governance, Risk and Innovation with Blue Cross. Welcome, Michelle. We also have Belinda Hocroft, a Director with the Commission in Operational Policy and Support, who is responsible for developing our current registration and audit material. And Nick Holdernesse, one of our Directors in Operational Policy and Support, who's currently responsible for the home care methodology. Thanks, Nick. So we will move through some panel questions. We're also, you have the option now to submit questions via the conference app. So I'll be looking at questions as they come through. I can see some are starting to come through now. And we'll also take questions from the floor. There's a couple of mics in the middle. If you go to the mic, I can see that you're there and I'll come to you. Okay, so I think this one might be for you, Nick. If a provider is audited, if a provider is due for an audit this year, what standards will they be audited against this year in 2024?
Thanks, Emma. So if a provider's due for audit this year, the full set of quality standards will still apply as applicable to the service types that you deliver. So that's the current set of quality standards 1 through 8.
Thanks, Nick. I'm wondering if we take a question here for Michelle. So I think it would be great, Michelle, we're very keen to hear from you about your experience with testing the new audit methodology.
Thank you, and hello everyone. I think for us, and it was great actually to hear your presentation, Emma, it felt like all of our feedback was included in the presentation, so that's good. Part of our challenge in being part of the pilot was that we found that there was a lot of duplication in the audit preparation process and then in the audit interviews that we did. So it was a lot of learning for us in terms of that preparation, but then having the interviews and the questions, it did feel like there was duplication in the process. So it's great to see that that feedback's been taken on board. In saying that though, preparing a really comprehensive document and hopefully preparing that document once will be very beneficial, I think, moving forward for us as an organisation, because we provide both residential and home care. I know this is home care now, but having that comprehensive document will be invaluable because it'll be a good source for us to continually monitor and improve. The other part was that, we found the auditors, it was like they were on a journey with us as well. So a learning journey around testing the new standards. So that was really, it was great to participate. And it was professional. The whole process was professional. There was, mutual feedback and respect through the whole process, which was also very welcome, particularly for the staff in home care, who for them this might have been a new learning experience as well. Very clear reasons were given for non-compliance once we'd gone through the audit process. So we were very clear on how we could improve. So very good emphasis on what was working well and the areas that, that required further work from us. And whenever there was a request for further information during the process, that was also very clear for us to follow up and then take on board. So, but one other thing I probably would say too is that, and it seems like this has been taken on board too, is that the questions, it's very hard in an audit process to separate individual components because all of the standards do overlap, which is what you would expect. So often the questions overlapped and were sort of multifaceted. So it was hard to actually glean out for us what exactly was being asked. So we certainly provided that feedback as well. It would be easier to be very clear or ask just a single, if you like, a single component per question. That's it.
Thanks, Michelle. There's a question here, Ingrid, which we'll have a go with you at answering, but we may not have the answer today. Where do food and nutrition services that are delivered in centre or home-based environments sit if Standard 6 is only for residential care? This has 23 likes, so everyone is very interested in this question. Yeah.
Thanks, Emma. Good afternoon, everyone. So that's right. The food and nutrition standard actually only does apply to residential aged care, and as part of the feedback that we received from the broad consultation process was that that was a little bit of a gap, that there is a need to consider responsibilities or an obligation around food and nutrition in the home care space. So certainly the department have taken that feedback on board and are considering what that might look like, and will consult with the sector at the appropriate time.
Thanks, Ingrid. Thank you. While you have the mic, we might ask the question, when will the standards commence? And is this changing following the Minister's announcement this morning that the commencement date will be updated for the new Act, sorry?
Thanks, Emma. Absolutely. This is front of mind for all providers. Absolutely appreciate that. As the Commissioner said in her session this morning, the standards will come into effect in line with the commencement of the new Act, and there's a reason for that. So the strengthened standards were developed to be a part of the broader reform agenda, and certainly they have been developed to work together with other aspects of a lot of things that we've been talking about today, including the provider registration model and obligations under the new Act. So introduction and commencement time frames, yes, they are a decision for government, but certainly we're all working really hard in terms of regular communications with the sector, continuing to work hard with the Commission in terms of the development of that really comprehensive suite of guidance material that will assist providers in understanding their obligations under the standards.
Thanks, Ingrid. There's another very popular question here. If a provider delivers home care service, sorry, Belle, I think you might take this one. If a provider delivers home care services in line with categories 1, 2, 3, 4 and 5, will the services that are being delivered under categories 1, 2 and 3 be included in the audit?
Thanks, Emma. The answer to that is no. So when the audit is conducted, they look and consider the service types that apply to category 4, 5 or 6 only. So in that example, the audit would only look at the services that provider was delivering in 4 and 5 and not 1, 2 and 3.
Thanks, Belle. So this is one for you, Nick, I think. Will the way the Commission does audit in home care change a lot with the new standards?
Thanks, Emma. So the way we do audit in home care will change, but importantly, we've already started moving towards some of those changes with our current audit program. So what we've been able to do is a bit of analysis of our current audit program, and we've looked for opportunities we can align to the new framework. And Emma mentioned earlier around multi-service audits that we already have supporting frameworks to conduct. We've made a decision to then include all home services of a provider in a single audit process going forward. So we've put that in place since February. That allows us to get a really good view of the provider and all its services it delivers. And from that, we can then sample evidence through the care delivery, through service level visits. So I think in terms of how it looks now and how it will look in the future, there's some standards that won't apply in the new audit framework, which is 6 and 7. But importantly, the key concepts remain in audit, which are things like risk management systems, quality systems, and these themes have been clarified further in the new standard too.
Thanks, Nick. There's a question here too, which we'll have a go at answering. I'll give it to you. Auditors review individual records. How will they determine an aberration versus a system-based risk? So I think that means... Sorry? So they're having trouble hearing sometimes because the sound goes that way, so I'm just going to give them the question. Auditors review. How will they determine an aberration versus a system-based risk? Looking at individual records, how do you know if something's just gone wrong this one time versus a problem system?
Thanks, Emma. And sorry for the audio difficulties here.
Yeah.
So where there's individual risks identified and how that looks in terms of a system deficit, what we're seeking to understand there is the context of the situation. So we seek to corroborate what we see through gathering further evidence around that event. And that helps give us an understanding about whether there are system deficits. And that's how we translate that back up to the system level. So what we'll do around those sorts of matters is undertake key interviews with staff, management, consumers to test their understanding of what's happened and occurred. And that's how we'll seek to inform ourselves about system deficit as it applies to episodic events.
Thanks, Nick. So there's a question trending here, Ingrid, for you, I think. Why do the standards have to wait until the new Act?
Thanks, Emma. So I think, really flowing on from my last response, the standards don't work in isolation. They're actually will apply as part of the broader regulatory framework. And as we heard in the registration session this morning, the application of the standards is very much linked to the category of registration of a provider. So it's very difficult to separate the standards in isolation of those broader reforms. So it's certainly intended that the standards will apply as part of that broader framework.
Thanks, Ingrid. So there's a question here, will there be learning resources contextualised for home care? I'll take that one. So yes, that was one of the key areas of feedback we've had on our guidance resources and through our piloting and testing. We are looking at developing more focused resources for home care around the strengthened standards in the process of. But that takes me to, I think, one of the purposes of having Michelle on the panel with us today. So I think this is a really nice opportunity, Michelle, for you to talk to us about how, if you can, you're preparing your organisation for the new standards and audit methodology.
Thank you. Yes, so again at Blue Cross we've already commenced looking at all of our policies and procedures from a governance perspective and against the new standards. So we undertook a mapping exercise and this was even pre much of the guidance material that has also been very helpful. It's been released. But we'd already commenced this exercise just to determine where are our gaps. And that was affirmed through the pilot audit process. So some of the things that were identified by the auditors confirmed where we had identified gaps, which was really helpful. I think aligning our policies and procedures, we extended that to both residential and home care, so we weren't confusing staff that may cross services, with duplication of policies and procedures, because we have a central repository. So if they were looking up a policy, then they'd find a policy that would apply to both the home care services as well as residential in our case. The other is then through the areas that we've identified for improvement, we've developed a continuous improvement plan. So to set us on track to continually prepare ourselves for the strengthened standards, which, obviously all of us initially thought was the 1st of July. So I guess it's given us some breathing space in terms of that preparation, but it also gives us an opportunity to really focus on what we need to do to improve as part of that continuous improvement plan. I think that's probably it.
That's okay, thank you. There's another question here about whether there will be a self-assessment tool available to help with preparation, and yes, there is, as part of the tools that are out for consultation at the moment, called the pre-audit preparation tool. slightly different name. We are really keen for your feedback. We are happy to look at tools such as that specific to home care, which I think will be part of the further work we do. So please have a look with that in mind. With the week we have remaining, we have a question here, I think. Okay, one for you, Belle, I think. Is registration of providers dependent on new standards and the passing of the new Act?
Yes, so registration is a new process that is outlined under the exposure draft of the new bill, which is on the department's website, and that includes the registration process for a new entity that's coming into and wanting to deliver Commonwealth subsidised aged care, as well as the renewal process for registered providers. So for some providers, those who are wanting to deliver services under categories 4, 5 and 6, there will be an audit against the new standards. There will also be a condition of registration for those providers where they need to comply with the new standards as part of their registration.
Thanks, Belle. I can see we have someone at the mic. Do you want to give your question?
Yeah, I was wondering how the CHSP guidelines are going to be updated to reflect the new standards.
When will the CHSP guidelines? How will the CHSP guidelines be updated to reflect the new standards?
Sure. So, sorry, it was really difficult to hear your question, but I think you were asking about the CHSP grant guidelines and how they might be amended to reflect the new standards. So when the new standards take effect, which will be on commencement of the new Act, those necessary changes will occur. CHSP, though, are likely to be in Category 1, in which case the standards won't apply. So to the extent that they don't apply, there won't need to be any change, but certainly, if there is, then the grant agreement would be updated at the appropriate time.
We have another one from the floor. Yes.
Gordon Katelby here, Worcester Care, Sydney. We regularly do a pre-audit ahead of the main audit, which we expect to come up sometime this year. Do we audit against the new standard or the old standard if we're expecting an audit before, say, November this year?
Okay, so you have an audit due. Sorry, we're having a bit of trouble with the sound, so I'm just going to repeat the question. You have an audit due this year. Which standards do you think should you expect to be audited against? So, yep. Okay. So our advice at the moment to providers with any audits coming up in 2024 is to prepare to be audited against the current standards. If it's a residential care home, you should apply for reaccreditation as usual. Okay. So we have a question here which is very popular. I think Belle and Nick, between the three of us, will try and answer. We've heard during the pilot process that the skills and experience of the auditor make a big difference on the experience of the audit, I presume. What are your minimum qualifications and experience requirements for auditors, and how is the quality of auditors assessed? I'll have a go and then you guys can add. So, currently, our quality assessors are required to be registered and go through a professional qualification, which they need to pass, competency-based qualification, which they need to pass. As Janet spoke to this morning, there's a significant program of continuous improvement work rolling through the Commission in the last 12 or more months around the quality, consistency, accuracy of our quality monitoring program. that includes changes to how we supervise and develop the competency of our quality assessors. Under the new Act, auditors, I think this one might be Belle where you step in if there's requirements for the qualification and registration of auditors. We haven't covered that yet. Yeah, we're expecting that to remain in place and to continue our training and professional qualification or registration program with auditors. Nick, did you have anything?
Yeah, just to add to that, we have invested a lot of time and effort to rebuild our competency framework and training program. And to complement that, we've also strengthened our quality assurance activities over our own auditors. And that's giving us a really good opportunity to identify areas for improvement. And as part of their ongoing registration requirements, they also need to complete set amounts of continuous professional development for each registration period. They're a registered quality assessor.
Thanks, guys. But we will also be providing answers to the Q&A after the conference, so we'll make sure we give a clear response on that one. I have two questions from the floor. The lady behind you was just first, so I'll go there first, thanks. It's okay, I'll come to you next.
Hi there, hopefully you can hear me. My question is, will the standards stay in draft until the Act is passed, or will there be an opportunity for people to say, this is what we know we're going to be dealing with, and then they have time, for example, dealing with software vendors who have, I've heard in a webinar recently that some software vendors that are assisting providers have said that they won't do really any changes until they know that what they're dealing with is the final version. So can we have the final version even though it's not actually in legislation yet?
I'll give that one to Ingrid. Thank you.
Yeah, thanks very much. So the final draft standards that were published on the department's website at the end of last year are in fact the final. They've been approved by government. The reason why the term draft is still there is really as a result of drafting the standards into legislation. There may be some very minor wording adjustments that might need to be made to incorporate them into legislation. The intent, the expectations of the standards will not change. So my message to you and to the rest of the sector is that please, you can absolutely rely on the final draft standards that was published on the department's website last year in terms of, you know, work and other things, working with software vendors and others to prepare for commencement.
Thanks, Ingrid.
Just a question for some clarification, please. One is the answer to the question about if your agency has an audit in 2024, you need to abide by the current 8 standards. In webinars and information and communication from the Commission up until very recently, there was still kind of like an expectation and a consideration that even though you had to meet the current 8 standards, you needed to show progress towards the 7 standards. Does that still sit within the framework of being audited in 2024? Will auditors be looking for organisations to provide the...
So your question is part of the current audit process, are we requiring providers to show progress towards preparation for the strengthened standards?
Yes.
Thanks. So as part of our current audit methodology, we are seeking to understand providers and their performance against the current set of standards and requirements. Within Standard 8, there's a requirement there around regulatory compliance, and so that requirement's around how providers are seeking to understand their obligations as it applies to them and their delivery of care and services. So simple answer here is we'll be assessing performance against the current set of standards, and we'd like to see you working towards and equipping your staff around the new standards outside of that assessment process.
Okay, thank you, because obviously organisations have been preparing for that are already underway in some way. And I have a second part to the question regarding some clarification regarding CHISP services, and I think Ingrid, was it? sorry, the lady in the middle here had a bit of an answer. Sorry, the question was, will the CHISP guidelines be updated and when? And some of the response back was that CHISP services might fall in category 1, therefore won't be subject to audits under any standards. But an understanding, one of my understandings is that CHISP as a service group includes things like personal care, allied health and social support group programs. So could you provide some clarification on that, please? Because that currently they fall under category 4, so therefore, according to what was said before, the previous thing, they would be, social support group activities would be still subject to conformance with standards 1, 2, 3 and 4 of the new standards.
Yes, so your question is, what about the service types funded under CHSP that aren't in categories 1 to 3?
That's it, thank you.
Yeah. Thanks for the question, and it is really good to clarify. So the standards will come into effect, obviously, on commencement of the new Act. To the extent we obviously have CHSP established under grant agreement, and those grant agreements will be updated to reflect the new standards. And I apologise for the confusion, but the point I was trying to make before was really around audit and I guess that the testing of those standards, conformance against the standards, category 1 to 3 versus category 4 to 6. So does that help?
So does that mean then that currently social support group activity, which is part of social and community engagement, does that still sit within, it would still sit within category 4, therefore they are still needing to comply with standards 1, 2, 3 and 4 of new standards?
Yeah, so social support is currently under category 4. I would say though that the registration categories and the definition are being finalised, and a lot about that is really the continuing development of the Support at Home program. And as you'd be aware, stage 2 of Support at Home will bring in CHSP into that broader program. So while currently the registration categories have social support under category 4, that may require a little bit of nuancing once the Support at Home program is finalised.
Thank you for your clarifications.
Thanks, Ingrid. So we have a popular question here. It's a really good question, actually. Will there be guidance on what standards are required for boards and volunteers to meet governance standards? There are 7 key standards, I'm not sure, volunteer governance organisations with volunteers need clarity on what the minimum requirement is, please. So I'll have a go at answering part of that. The Commission's been running a training program for board members for I think nearly 2 years now, called Governing for Reform. There's a lot of really excellent material on our website that supports board members and their development and understanding of their role. The question about volunteers, I might take on notice unless, I think it's a really good question, so I'm going to take that one away to put in our Q&A and make sure we come back with some clarity on that, so thank you for that. We've got a question here, will the evidence tool used by the Commission during the audit process be available to providers? I will say that that is the digital audit tool, and we're looking to provide full transparency really around that process for providers who have access to that information during the audit process. So our auditors are working in that tool and providers can see what their responses are and what their ratings are. Will there be a push to complete overdue quality reviews prior to the implementation of the strengthened standards? So this is a transition question. Do you want to, I can take it, or have you got?
Thanks, Emma. We currently have a push on to increase our quality of review numbers at the moment. So we've caught up on our backlog in our residential services, and where there's capacity, we are also applying that into the home care services for quality reviews. I'm not sure if there's Anyone else who wants to comment?
So the other part of the answer, so post-COVID, we have been increasing our home care quality review activity as we're recovering our program from being impacted by the pandemic across residential and home care. That increase is not about getting ready, I think what Nick's saying, for the transition. However, there will be transition arrangements which are being worked through with the department at the moment, and once those details are available, we will be providing additional guidance and support and advice to you on how that will work, including when the current processes under the current Act turn off, and the deeming process, which you would have heard about in the registration session, would carry providers across under the new Act. So those things are still being worked through, but we understand the interest in that, and that information will be widely made available when it's clarified. Is that fair? I can see a lady there for a question. Thank you.
Sorry, I was the person that asked the question about the standards. So I just want to give you a bit more clarity on that we've registered for the BNG portal where you put all of your standards that are required into that portal, and it maps out where you have gaps to meet various standards. My question lies around, there are 70 standards in that portal, governance, volunteer standards, and in a community centre environment, what's the minimum standards that we need to comply with? And through the research that I've been doing, I'm finding it very difficult to get clarity on that. So when you look at the governance standard in the aged care standards, do you have any minimum essential requirements under governance within those 70 standards that we should be focusing on?
So when you say 70, are you looking at a system that has multiple sets of standard frameworks in it?
Correct,
yeah.
Yes.
So you're saying what work is being done to look at how the new aged care standards interact with those other frameworks?
Yes, so in order to meet the new standards, what other frameworks are you looking for us as organisations to implement to tick off your essential requirement, to save duplication of what we're doing when we have to meet other standards like the Australian Service Excellence Standards and National Child Safe Principles? When you're having to do multiple standards, what collaboration is there to mitigate duplication?
Yes, I thank you. That's really clear. So I think Robert spoke in our registration session around work underway to consider harmonisation with the disability standards. I have to be honest, we haven't specifically taken that lens to the transition to the new standards, so we will take that away and have a look. And again, I think something we can have a look at providing some clarity on in our Q&A. But yes, I understand the perspective and the question. Thank you. So this question is, what are the timeframes from when we're asked for auditing information? I think this might be you, Belle. If we may not know yet, but we'll try. What are the timeframes from when we're asked for auditing information to the date we need to supply information to when the auditors visit?
Yeah, we don't have those specific timeframes at this point in time. As we're developing the audit methodology and considering the registration decision-making process, we will be seeking some further information through the legislation, the Act, in regards to some of those timeframes and thinking about how that would work. It will be an informed process. So when we are writing to you and initiating the registration process and talking to you about the development of the audit program, we will be very clear around those timeframes. And I imagine as we develop guidance, as we move towards commencement, we will be providing further information on that for you. I know that there's been a commitment to transparency around much of that activity. So while I can't answer that exactly, we will be providing those details in the future.
Yes. Okay. So this is one, Ingrid, around essentially what is encompassed in Standard 5 for home care providers. So the question is, under the new Standard 5 for home care providers, where you provide care management but not clinical direct care or nursing, how will the standards be measured? Will this be contextualised based on a provider scope?
Thanks, Emma. Absolutely. So the application of Standard 5 to home care providers where there is nursing services and other complex care that's delivered, it will be proportionate to the services delivered as to how Standard 5 will apply. The Commission might want to give some sort of further detail, but certainly Standard 5 is a really large uplift, and there's been a big focus in clinical care under the strengthened standards, and I'm sure you would all acknowledge that it was a key issue coming out of the Royal Commission, and it is important that we, each understand our responsibilities under that new standard, but certainly the application of Standard 5 to home care providers will be proportionate based on the services that are delivered.
Thanks, Ingrid. So there's a good question here. I think Belle will have a go. As a provider of both home care services and residential, when being audited, would it be expected to have overarching policies for Cat 4 and 5, and then individual processes based on delivery of the service type in home care or residential?
Yeah, that's a really good question. And Nick, you may jump in at some point as well. When we're looking at the audit program for a provider that is covering categories 4, 5 and 6, we would be starting by talking to you and the governing body about your governance, your processes, your systems. So an example of that is we may be talking to you about your complaints management system in regards to how you manage complaints as a provider. We then, through audits of individual residential care homes, or in regards to the Category 4-5 audit, have a look at gathering evidence around care delivery. So example of that is in regards to service delivery through allied health, for example, in Category 4, what does that look like in regards to complaints of issues around allied health services?
Thanks. I think I'd agree, and where we wouldn't be expecting you to develop a whole range of different policies and procedures because it's a different care setting or service type. I think simply if the context of delivery has nuance to it because it's in a different care setting or the way you need to deliver it changes, then you'll need to structure policy and procedure around that.
Thanks, Nick. There's a couple more here about the audit process. Or Nick. Will audits for Category 4 to 6 be planned at site level? And we'll take this to be the home care context. Oh, well, so it wouldn't include 6. Well, maybe we'll answer both. Yeah. I'll do it again. Will audits for Category 4 to 6 be planned at site level? Category 4 and 5 being home care and 6 being residential, so the answer will be different.
Thanks, Emma. So for Category 6 service type, audits will be undertaken at each site, and there'll be a planned program around that. For Categories 4 and 5 service types, there'll be a single provider audit. This will involve sampling care and service delivery at one or more locations where they're either coordinated from or where care delivery occurs at.
I just want to add, though, in discussing with you the audit program, again, we'll go through those details with you. So explaining the evidence gathering process, both at, with the provider and also how that occurs when we're considering care delivery.
Yeah. There's a question here that is trending strongly, Ingrid. Why does Standard 5 not apply to personal care in Category 4? Or why does personal care not in category 5 might be another way to understand it.
Thanks, Emma. So this is another one where
Oh, sorry, I've misunderstood, sorry. Why does Standard 5 clinical services not apply to personal care in category 4?
Yep.
I get my numbers mixed up, I'm sorry.
Yep. So personal care services at the moment are identified under category. Sorry, now you're getting me mixed up. Category.
Categories and standards. Why doesn't
Personal care. Yeah, so personal care is an element of service delivery that at the moment is not intended that Standard 5 will apply. But likewise, as I mentioned before, in terms of some of the service offerings under the Support at Home program, that may change depending on the outcome of the Support at Home program. It's certainly proposed currently that it will be separate, but I guess I would like to confirm, please realise that the definition of the categories is yet to be finalised.
Thanks, Ingrid. Oh, we have a question from the floor.
I have a suggestion and a question. Maybe the categories could be A to F or something and the standards 1 to 7. That's just a suggestion. My question is, with home care, getting the consumer voice during the audit is one of the hardest things. We were part of the pilot. Our pilot was completely virtual and it was really hard to get the consumer voice. You mentioned in your presentation, once you said it was going to be a hybrid model, and then the second time you said it was going to be virtual for home care. So I just want a bit of clarity about how you're actually going to hear the consumer voices during the audit, whether you're going to visit people at home now. A phone and on the internet does not work, particularly I work for the Multicultural Communities Council, and it just doesn't work.
Thanks for the question. So our intention is that we'll undertake a hybrid model when we undertake audit, which is a combination of desktop-based evidence review and also on-site activity. Included in the on-site activity, we may make phone calls as part of that to consumers. Where there's opportunities for us to meet directly with consumers, we'd like to take that opportunity because we'd really like to hear the feedback and get a chance to meet them and get a good understanding of their experience.
Yep. Michelle, yes, thank you.
Just to add to that was certainly part of our feedback as well, was that part of the challenge of interviewing clients in home care, many of the clients that were phoned didn't quite understand the questions. They didn't understand what was being asked of them. And so we certainly provided that feedback back, whether there was, well, we encouraged a desktop audit, and part of the desktop audit was also to determine who, and through conversations with the clinical staff or allied health nursing staff in particular, who may be a person that we could talk to who might be able to cope with a telephone call, or is there an opportunity to do a visit and speak to that person? So we certainly found that ourselves during the audit process, that it was a challenge, and many of the clients became quite distressed. And then we ended up speaking then to their representatives and not actually them. So then it's hard to tell whether you're getting the true voice of the actual consumer in this process. So absolutely agree with that question.
Thank you. Yes, and that's some of the changes we're continuing to look at, because we certainly don't want to lose that engagement that we currently have in the current process. I'll take one more question and then we might have to move on to close.
Hi, Najila from Star Nursing Services from Sydney. We are all excited about, obviously, the new approach towards the new Act. When we are talking about the Standard 5, especially clinical care, my worry is that it requires a lot of working resources, such as registered nurses involvement or allied health involvement in the care of consumers, and it takes a lot of funds taken away from them doing all these assessments or care. Has Commission have thought about changing the funding structure available, especially in relation to level 3 and level 4 consumers, that they need lots of, assistance towards their care? And my second question is, what have you done in order to reducing the time they have to wait for reassessment? Because during that 4 or 5 months waiting period, the quality of medical care will be affected quite heavily, and that would be a reflection of us as a provider.
Did you get the first one? Can I check that the question was around, will there be additional funding for packages 3 and 4? That was the first part of your question. Sorry, we're having a lot of trouble with this mic. It's very unclear. Come away from the mic.
General, I was thinking about, we have focused on everything except the funding part. That's one thing which is extremely crucial. If you want to improve the quality of care, we can't, our hands are very tight in terms of what we have at present. And secondly, the times taken for these poor consumers, especially level 3 and 4, to be, the lower level to be reassessed for higher level of care. So these are the major issues that I haven't heard this morning till now. Anyone actually address it? And I think we are a bit maybe ignorant towards it. I'm not sure, I might be wrong.
Is it about the funding? Yeah. So we have had a few questions about funding and how it relates to the changes in the standards. Is that, and I think we'll look to address them in the Q&A because we've got 2 minutes now and I need to move through. We've got some Mentimeter questions to close. The first one is, these are accessible via the app. Is that right, Mel? Yep. Oh, here we go, and the code should be on the screen. You can go to the Menti on the front screen of your app and put in the code. So the first question is, how can we improve our resources? Continue to improve our resources. Oh, I can see on the screen. Home care specific, yes, we're on board with that. Volunteers, that's been a really good point to raise. Contextualised for home care, specific to home care, translated, yes, we're producing translated resources for consumers and workers. Specific to the home care package program. More attention to remote areas, yes, we are looking at resources specifically for rural and remote services. More practical examples. Letters to give consumers, yes, they're part of the package of support material for audit that we will provide. Be clear and specific, absolutely. Consistency. More simplified for volunteers. Thank you, everyone. That is really helpful feedback. The next question is, what else would you like to see? Which might be a bit similar. More of the same. Digital tool, yes. We're excited about that too. Education. Pricing, more stability to finalise the categories. Resources that I don't have to adapt. So yes, I think in preparing for the standards this time, we are also looking at simplifying those resources and making them applicable for providers to take off the shelf and use with their staff. Sample policies and procedures, more emphasis on home care. Extra funding from government for home care packages. I think that was one for CHSP. Clarity of resources. So if you haven't had the chance, so we'd really value your feedback on the new digital education tool on the standards, to have a look while that's there. The idea of that is you can, the tool will filter the information to who you are and what information you need to help you access and digest the large volume of information we need to produce to cover all the standards for all the different contexts. We're hoping that the tool works to tailor that information to the person asking. Harmonisation, yes, that's definitely a theme we've heard. So thank you everyone, that's also incredibly useful. I won't keep you from afternoon tea, so please enjoy your break. And thank you for all your questions today and your feedback that you've provided and continue to provide. And we will be taking those questions we couldn't answer more fulsomely today to give those answers online through the Q&A. Thank you for coming.